Hello, today I'm going to be showing you how to go about muzzle training your dog. There are quite a few situations which may require a dog to wear a muzzle. I suppose the consulting room at a vet practice would be the one I'm most familiar with, and it's always a very good idea to have shown the dog a muzzle first and let them see what it's all about and that it's not anything to be concerned or anxious about. Much in the same way we teach them how to wear a collar and lead, I would suggest that every dog has been muzzle trained for just the situations where they may require it. If introduced in a gradual and positive way, it would be something that I would expect certainly nearly every dog to accept and cope with well for short periods of time. The first thing is to find an appropriate sized muzzle. We tend to use the basket muzzles because they don't interfere with movement of the jaw or respiration in any way. In regards to fitting, when the muzzle is on, it should not be in contact with the patient's eyes at all, and it should be a few millimetres away from the tip of the nose as well. So for example, this one has too much space in it. Good boy, sorry. This one is too large for Ari's little face. You can see there's far too much room in there for it to move, and he would potentially be able to pull that back off over his nose. In regards to training a dog how to put it on, the first thing I would do would be show it to the dog and let him see and examine it. Ari's rather familiar with it at this point. The next thing I would do is pop a few little treats in there for the patient to eat off the muzzle. Once they are accustomed to sort of popping their nose into the muzzle, the next thing is to place over the patient's nose for a few seconds. And I tend to go 5, 4, 3, 2, 1, take it off, and loads of praise. Well done. If your dog is quite food orientated, then you could give them a few treats for being a good lad. Once they are, very relaxed about having it placed over their nose, you'd place it over their nose and clip it up at the back as well. And again, I tend to go 5, 4, 3, 2, 1 and take it off for the first time. In regards to tightness, you should be able to always get a finger into the back, and it needs to be snug enough that the patient wouldn't be able to pull it off over the nose if he were to get his paws into it there. So that would be an appropriate tightness for Ari wearing it at the moment. He's a good lad. If a patient's unsure, often coating a little bit of peanut butter in it can give them something to think about while they sort of lick it off also. So that would be how I go about doing muzzle training with a dog.